I like to start the sessions with a unilateral neck stretch anyway, a lot of times, just to evaluate, also calm them down. Also, you're looking them in the face, you get some face contact, show them you're not afraid to look at them, just get in there. What I do is gossip. My friends, I do everything that they tell us in psychology not to do, transference. You're not supposed to have pictures of your family. You're not supposed to gossip about anything. I do all of it. To me, all my clients are my friends. I love them. I don't love them, but I love them. You know what I mean? You love them, and you want them and their family to come to you, get on a schedule, come to you for the rest of their lives. You know what I mean? Maintenance, man. We maintain our cars. Come on in. Sometimes, it's 3 months. I can move them out to try to get more people in. But, love them. Okay, Kyle, you ready? Okay, so first just starts with the, what are you popping off about, Kim? Okay, so just a nice soft thing. I'm evaluating. And what else am I doing here when I'm doing this right here? What am I trying to test for and restore? Cervical curve, exactly. I'm trying to, because I got his head pinned to the table, so I'm wanting to restore cervical curve. So I'm just going to lean my body weight back, always thinking, don't work too hard. You got a bunch of people lined up. You got a not many years left in your life. You got to. So anyway. I go down into the cervical thoracics. Huh? That's how you felt this morning? I'm with you, girl. Okay, so down here, spreading up, if they've got a Dowager's hump, what better thing to do is to try to kind of get a little compressive force through there. And all the way up to suboccipitals. I can have him turn his head left against my resistance. 2, 3, 4, 5, and relax. I could come over and start doing this. Make up your own versions of this, but it's just a great way to start. This is just testing his head rotation, checking the lateral and posterior fascia. And then I can cross over and stretch, turn left, 2, 3, 4, 5, and relax. Left, 2, 3, 4, 5, and relax. What's that stretching? When I'm rotating him and right rotation, right side bending stretches. What on the left? For a T-shirt. For a poster. I didn't hear any T-shirt worthy answers yet. Okay, we got a couple. We got a couple who's the levator scapula. And what's the other one? Splenius cervicis, levator scapula, primarily. But I am going to throw a couple posters out anyway for all you guessers. Okay, so obviously we would do both sides, and then we come into a little bit of evaluation again with this hand grip, which I encourage you to use all the time. Dominant hand on top, coming in on Kyle, and as I lean my body weight back, I'm compressing. They naturally will do that, so you just come in. Make sure you get low, you're not working too hard, so I can put a compressive force through there, and checking that lateral fascia, checking in translation, you're checking the ability of the superior vertebra to glide on its inferior neighbor. He's got into a little problem right there. He doesn't want to glide. Turn your head right. Turn your head left. And relax. Okay. Side bending. We went through that. Decompression. Okay. Decompress, decompress, decompress. And just check out all that lateral fascia. Okay, alternate OA. Remember how we did this? As we step to our left foot, we cup and pull headward with our right. Now here's a little tip that makes this more effective. In the beginning, just learn it like this so that you're just kind of using your hands and everything to do this, to pull up. Your goal eventually will be, here's Kyle like this, will be to do this, affect the fascia underneath so that you're doing this. Open condyle on the right, open condyle on the left. Those people that have cocked heads, their eyes aren't sitting straight, away side to side. The away joint's a very complex joint. Concave on the atlas side, convex, concave convex theory. Look it up. Google concave convex theory, and it's very odd. It causes rotation and side bending to opposite sides, whereas atlas axis is convex on convex. Okay, so as I'm stepping, I'm pulling up on the lateral fascia anywhere I want to be. I come into the suboccipitals, particularly is what we're talking about, rectus capitis posterior major, rectus capitis posterior minor, inferior oblique. Do not forget the inferior obliquus muscle. It's a very, very important muscle because it does not attach to the skull. It comes from C2 to the transverse process of atlas. What does that mean? That means that chiropractors make a fortune off that muscle because one of the most popular techniques they do is rotation. What is that? Atlas axis adjustment, you know? And if inferior oblique is tight, sometimes that just irritates it. If you're a stomach sleeper and you're always sleeping on one side, the inferior oblique on the right side, if you turn your head to the right, it's going to get shorter and shorter and shorter every night. One on the left, hyperextended, long. And so one day you get up and atlas doesn't want to roll back onto axis like it's supposed to. And then it starts a whole compensatory thing down the neck, headaches, particularly those ones that heartbeat headaches you hear, kind of a pounding, a vascular headache you hear when people are when you're sleeping particularly, you can really hear it. Have you ever had one of those where you can kind of hear the pounding or the pulsation? Never? I don't have headaches either, but that's what I hear a lot from clients is that, it kind of feels like I can hear it and feel it in my head or my ear, kind of a pulsating type thing. That's what that is. That's an atlas axis problem with the vertebral artery on that side overstretched. Okay, so that's a wonderful technique. Use it.